We're going to talk about what is the Medicare market. I know you've probably heard that before. And what do they want? So what do they want from us? You're going to spend a lot of your time and energy, and the company is going to spend a lot of its resources to get you in front of prospects. If you have the same definition of the Medicare market as most other salespeople and most other companies, then the message your prospects hear may sound like the same. So let's talk about this. I'm Lloyd Lofton. It's my email address, lloyd@lloydlofton.com. Anytime you're on the phone and you struggle with a prospect, or you get an objection you're not able to answer, or they tell you something you're not really sure about, shoot me an email. I'm happy to answer for you. I'll do that with you as many times as you need to. That's also my contact information. Let's talk about what happens at retirement. A male turning 65 or 66, depending on when he's born. So for example, I was born in 1954. I get full retirement age at 66 and 7 months, which, by the way, I'm not going to take. I'm going to actually go to 70. But here's three things that typically happen, almost without exception, when someone signs up for Social Security. So as they age into the next phase of their life, they're going to sign up for Social Security. When they sign up for Social Security, they're going to automatically be enrolled in Medicare. And of those automatically enrolled in Medicare, about 80% are going to get some kind of supplement. Now, I get it. We don't know what kind of supplement they're going to get. I understand that. But we know that they're going to get some kind of supplement. So when you're prospecting and you're talking to people that are aging into Medicare, you already know these three things about them. Before you ever have a conversation with them, before they share one syllable with you on the phone, before you even comment about who you are or who you're with, we already know this. We know that they're going to sign up for Social Security, they're going to automatically be enrolled in Medicare, and 80% are going to get some kind of supplement. And if they're going to delay Social Security, like I did, they're going to sign up for Medicare and they're going to get a supplement. And those are what I call anyway behaviors. It's a predictable buying behavior. Let's talk for a minute about why seniors buy senior products. What's the reason for this? I know it seems pretty simple that they buy senior products to protect themselves from cost. At least that's what we tell them. Tell them we can save them money. We tell them that we can cover the copays and deductibles Medicare doesn't cover. I know that. But really, when we say that they have a need for protection, when they talk to you about a need for protection, what kind of protections are they talking about? Yeah, there's the financial protection. You protect them from a premium that impacts their budget. We protect them from going to the hospital, doctor, or clinic and paying copays out of their pocket they weren't expecting. I get that. That's pretty common. There's also other things. When they go to the pharmacy, we can protect them, and they want to be protected from getting medication that ends up being more expensive because they didn't know that they could order it by mail or get 3 months at a time. They want protection when they go to the hospital for what they feel like is an emergency, and they get put into a room for observation, and then they're released the next morning. But they weren't actually admitted to the hospital. That's a different type of out-of-pocket expense. They want protection from surprises. So they have a medical condition, they go to the hospital, and in the next 90 days, they get readmitted to the hospital for the exact same thing. We know that deductible's not going to be there for them, right? But if they get admitted for something different, even slightly different, they're going to get hit again. 6 times a year, they can get hit with this. It's a different kind of protection. They also want to be protected from having their spouse be burdened with the unknown. With their spouse being burdened with not knowing how their plan is going to work. They've had situations, they've had experiences in their lifetime with medical care, and they know the consequences of the experiences. either the added cost of unexpected expenses while they're hospitalized, the added cost of recovering home after a procedure, and some of them have experienced the added cost of a loved one dying. They feel a need for protection. And those are the kind of conversations we have to start having with prospects, not just about the product or the price or the company. They want to transfer their risk from themselves to an insurance company. That's what they want to do. We're talking about more than just financial risk, although financial risk is huge. People will always tell us that they can afford certain things. Here's the thing about life. At the time I make a purchase, my perception is I can afford any exposure that I think I'm going to have in the future. But along comes Thanksgiving, along comes Christmas, and a condition hits me, and that condition causes an unexpected expense. It's an unexpected expense in durable medical equipment. It's an unexpected expense in family outlay from family coming in from out of town to be here. It's an unexpected expense for recovery. They want to transfer risk from themselves to the insurance company. In other words, they want the insurance company to provide the resources and the tools they need to protect themselves and protect their family. You see, the key to success in working with people aging into this next phase of their life is to establish the need. Not the need that you think they have, not the need that you think they're going to have, but to find out from them what needs they're concerned about. Find out from them what needs they have experienced in their family. Listen, your peer group is about 5 years of your age, within 5 years of your age. So if you're talking to someone who's 65 years old, they already know somebody who's 70 years old. They already know somebody who's signed up for Social Security. They already have a relationship with someone who's had Medicare. In fact, they've already gone through a conversation and empathy for a family, friend, or relative who experienced an unexpected cost, an unexpected treatment, and an unexpected bad experience in managing their health care and their recovery. That's the conversation we have to have with them. And once we help them establish the need that they want to make sure is taken care of going forward, think about this. As you age, do you get more healthy or less healthy? I mean, if you're a pretty normal person, you probably said less healthy, right? And as you get less healthy, do your medical expenses become more expensive or less expensive? I'm guessing, again, if you're a pretty normal person, they become more expensive. So we have to establish the need because they already know the experiences of family, friends, and relatives that have gone through this. We have to walk them through that journey. And then we have to help them determine an affordable way to pay for that coverage. So we don't know what the coverage is going to be yet. Don't even have a clue what that is. At least you shouldn't know. You should not know what that coverage is going to be before you've had the conversation with them. If you do know what that coverage is going to be before you have the conversation with them, then you're just pushing a product, and shame on you. So what are the primary buying motivations of people that are aging into this next phase of their life? Well, they want control and independence. And control might be something different than what you think. Yes, they want to control what doctors they go to. Absolutely. They want to control where and how they get their medication. And yes, they want to say and where they get treatment. Although where they get treatment can be predicated on the type of plan they have, what district or network they're in, a lot of different things. But they also want control over the choice of where they get that care. They also want a choice over what type of care they can get. And they want independence when they get that care. So if they have a pacemaker put in, they want some control over when and where they get that pacemaker. They want control over when and where they go in to have that pacemaker read. And they want control over being able to have that pacemaker read in what they consider to be emergencies out of their home, out of their kids' home, or on vacation. They want control because they have kids or family in different parts of the country. My wife just got back from Las Vegas. She was in Las Vegas for a few days visiting our son and his family, our 2 grandkids out there. And she drove over to California and visited her sister. Next month, she's going to Iowa, where she's going to visit our daughter and her family and our 2 grandkids there. She's also going to see our son, who also lives in Des Moines, Iowa. I'm going to go out to Las Vegas in July to spend my grandson's birthday with him. And my wife's going to go to New York for my daughter's surgery later this year. That means that we want to have control over what type of health care we get when we're making those trips. And we want independence, meaning that we want the ability to pick where and under what circumstances we get that treatment, barring emergencies. So this population wants control and independence. Control and independence means that they get to protect their assets. That means that the plan that they have in their mind and their understanding will cover the expenses that are expected and will cover the unexpected expenses. And the reason that protects their assets is because as they continue to age in retirement, they don't have the time or the resources to make up any losses. When they have to pull money out of savings, when they have to pull money out of money market accounts, when they have to pull money out of stocks and bonds, when they have to pull money out of their home, that is not protecting their assets. Remember, when one of the spouses passes away, the other one still has to live, maybe another 10 or 20 years. That's a huge concern. But the other assets that they want to protect is their time. The time is an asset. That's an asset that they cannot replace. And they don't want to be jerked around from doctor to doctor to doctor to clinic to hospital to hospital. They want the ability to see the doctor, go to the hospital, and when necessary, visit the clinic that will give them the best care and the best control. Because their asset is their time. They want access to quality care. So when they go to that doctor that they picked, when they go to that hospital that they're comfortable with, and when they go to that clinic in an emergency, they want quality care. Quality care means something else too. Quality care means that when they're getting that care, their spouse has to worry less about how they're being treated. When they're getting that quality care, that means that they have more emotional energy to put forth to the rest of their family, to their siblings, to their own children, to their grandkids. And they can focus on that experience rather than worrying about the condition. It's not perfect, but it's a conversation to have because that is what they're concerned about. When we talk to them about control and independence, protecting their assets, having access to quality care, what we're really talking about is helping them relieve the burden on themselves, for the discomfort, for the pains, for the suffering, for the challenges, for the expenses that they're bringing their family, the burden for their spouse, for the care that they have to provide the sick spouse, for their spouse, for the potential concern of being left alone, for their family, their kids, their siblings, for the concern about providing the support they need to have. Sometimes kids can't leave jobs to come and be with the parents. They have their own kids that they have to take care of. They have jobs that they can't take time away from. We can help them relieve this burden, and that's what they're looking for. They're not looking for the cheapest plan. They're looking for the plan that's going to help them lift that burden. And you won't know what that burden is unless you have that conversation with them. And you can't have that conversation with them unless you're the type of sales professional they're willing to share that with. And when you have that kind of conversation with them, you help them and you bring to them peace of mind. Peace of mind that the medical care they're getting is exactly what they need, that the medical care they're getting is at the exact time that they need it. Peace of mind that the cost of that medical care is exactly what they expected it to be. And peace of mind that they're not passing that burden on to their loved ones. This generation has an aversion to welfare. They don't want the system taking care of them. I don't care what anybody tells you. They don't want the system taking care of you. I get that Medicare Advantage plans have zero premiums. I get that. It's also tied to the system. So we want to make sure that they understand how any program, Medicare Advantage, Medicare Supplement, how any program is impacted by government regulations, because they all are. And they don't want to be dependent on welfare. They want their welfare to be dependent on the choices they make. So we've got to make sure we have that conversation with them. So how do you market to seniors? Keep in mind, there's not a typical senior. However, there are commonalities. It's helpful to understand what those similarities are. So for example, I'm going to be 66 this year, but I have polio. When I was 4 months old, I wore a brace, corset, and crutches till I was 16. I had 7 muscle transplants. I was in a body cast for 9 months. I've had 34 surgeries in my life. I could not see a doctor today. It's not possible for me to see a doctor today who's even seen polio. I'll be 66 this year. A doctor would have to be like 90 years old to have ever seen a polio patient. I'm very similar to other people my age, but I'm also different. Some people you talk to on the phone have a hearing problem in their left ear, and they're right-handed, so they've got the phone up to their left ear. And they deny to their spouse that they have a hearing problem. It's the speaker on the TV that causes them to turn that volume up. It's not that they don't hear you or they're not interested. They're similar to other seniors, but they have their differences, and that's one of their differences. Some people have cognitive deficiencies as they age. That doesn't mean that they're stupid or dim-witted or they can't understand the spoken word or they don't grasp concepts. It might mean they just need a few minutes to make the connections. It might mean that you need to say it a different way so they can make the connections. It's helpful to understand the similarities, but we got to respect the differences in people. People talk from their frame of reference, and people hear from their frame of reference. Just because you say something and use words and terminologies and concepts that are common and familiar to you does not mean they are common and familiar to your prospects. That's why we want to have this lifestyle conversation with them, so we can parrot back to them the words and phrases that are common and familiar to them. Seniors tend to focus on how a situation makes them feel. Their responses are based on their total life experiences. That's one of the great things about working with this generation. They've already had a lifetime of experience. They've been married and divorced. They've had kids and lost kids. They've had houses and lost houses. They've had great financial success. And they've had failures. They've had cars and they've had wrecks. They've had a lifetime of experience. And it's those experiences that project for them the concerns for the rest of their life. Remember, when someone retires, let's say they retire at 70 years old, they could be in retirement almost as long as they were in the workforce. If they retire at 65 and they live to 90, they could be retired for as many years as they were working. We have to focus on the emotion. Remember, people buy on emotion, they're moved to action by logic. People buy on emotion, and they're moved to action by logic. We'll talk about that in one of our upcoming webinars. Like, we're going to talk a lot about emotions and words and buying habits in our upcoming webinars. Seniors tend to focus on how a situation makes them feel. So they like two things. They like to hear their name, and they like to have their opinion asked. You should be asking a lot of their opinion, because their opinion matters. And their opinion will tell you what bothers them and what problems they want to solve. So to effectively market to seniors, we have to understand their perspective. And their perspective may come in a different package than the tried and true industry jargon that you've been using. We need to learn to communicate with people back as people again, and not insurance agents. We need to learn to have a conversation with people about their lives. We need to learn to listen to understand and quit listening to respond. We have to understand from their perspective, and we can't understand their perspective if we don't get it from them. We have to account for age changes. That's their cognitive ability to process information. You might have to slow down. It's their ability to hear. You might have to lower your voice. You might have to raise your voice. You might have to pull the phone away from you a little bit to compensate for the hearing problems. They might have a visual problem. If you're doing a screen share with them, some fonts are too small for them to be able to read anything. And they're probably not going to say, I can't read that. They're going to give you a rote response, And whenever they say, that probably means I don't get it, but I'm not going to tell you that because I don't want you to think that I'm stupid, ignorant, or I can't read. We have to add emotional value if needed. People buy on emotion or move to action by logic. We're going to talk a lot about that in the next couple of webinars we have. People buy on emotion, they're moved to action by logic. What are some other factors? Take a second, right now, take a second and just jot down a couple of other factors that you think affect marketing. Just one or two things. Well, one of the things that affects marketing is how we heard about them. They are curious about that. My experience is they just want the truth. One of the truths is my company provides me a profile list of people turning 65. And when I got your list, I looked at the people that were in my zip code, and I happen to be in the same zip code as you do. And the reason I'm calling today is because I know there's been a lot of information in the news about the proposed changes on Social Security and Medicare, and most people I talk to have a lot of questions about it. So calling you today to find out, are you more concerned about the changes in Medicare, how the change in copays and deductible on Medicare are going to affect you? Or are you more concerned about the proposed changes on Social Security? Which of those have the most concern for you? See how that question addresses those things we talked about today. Finances and employment. Those are other factors affecting our marketing. When I talk to them about proposed changes to Social Security and Medicare, I hit exactly what they hear in the news. In fact, if you want to know what your target message should be this week, watch the news. Go online and look at what's being said about Medicare and Social Security, because that's what your prospects are exposed to, and that's what's creating the questions from them. Their social structure. There's a difference in a person's perception and their ability to have control and independence in their life. If they have 4 kids, none of which live in the state that they live in, or they have 2 kids who each live less than 3 miles from them. There's a whole world of difference there. There's a world of difference in having a disabled adult child living with a couple and their siblings living in other states versus having 2 kids with 7 grandkids that you never get to see. All those things make a difference. We can't talk to the social structure without asking questions. Now, I know what some of you are thinking at this point. You're thinking, God, Lloyd, I don't have that long on the phone with them. We're going to talk in our future webinars, we're going to talk about some questions we can ask that will drill down to this pretty quick. And actually, maybe the habit that you have of being on the phone for the least amount of time is a habit we need to address. Maybe the more time we're on the phone with someone, the better chance we have of them making a purchase. Remember, people buy on emotion and move to action by logic. We have to address the health changes that go on with people. We've already established, and I'm hoping everyone agreed, that as you age, you don't get less healthy. I mean, more healthy, you get less healthy. And as you get less healthy, your medical expenses become more expensive, not less expensive. So we want to elicit from them when their parents got older in age, what type of health changes their parents went through. That way they emotionally relive it again. And when they relive it again, then they can align themselves with that and associate their own experiences. So what are their top concerns? Well, the top of concerns tends to be, not everyone, but outliving their assets. I mean, they say they can afford stuff, but remember, the second to die is the one who has to live the longest. So if I die before my wife dies and she's 4 years younger than me, she's going to live, she's got a lot of years to live. So it's not necessarily just outliving the assets, it's leaving assets around for the surviving spouse to live through. Oops. Maintaining their independence. Now, independence doesn't necessarily mean that they're not getting care in the home. They very well could be getting care in the home. But they want to say and how they get that care. Their own health and safety issues are important. If someone's walking with a cane or a walker and they don't have level ground when they go into a doctor's office, we want to know those are the concerns. I'm not saying you can do anything about it, but you want to let them express those concerns. For seniors over the age of 75, the issue tends to gravitate to family and friends, leaving a legacy, their reputation. So those are all some of the concerns. Let's look at the top concerns. We have to listen. Remember, I said you want to listen to understand, not listen to respond. You want to ask questions. You want to ask questions that uncover the issues and problems that prospects are feeling and are facing. Keep in mind, questions gather information. Objections disclose information. Don't be afraid of objections. If you've been on the phone with a prospect for whatever period of time, 10 minutes, 20 minutes, an hour, and you didn't get the sale, there's a good chance you didn't get it because you didn't get an objection. Questions gather information. Objections disclose information. Be honest and ethical. They prefer the truth, even if the news is not good. Just make sure when you deliver the truth, you do it directly, succinctly, and monotonely. You don't add emotion to it, you just state it the way it is. Tell a story about the use of the product. Don't talk about the product. They're not interested in the product, whether it's a MedSup or MedAdvantage. They're interested in how they could use that product. Seniors are typically concerned about four things. They're concerned about managing the cost of hospitals, doctors, outpatient services, recovering home after a procedure, or not leaving a financial burden for their family. Now, I want to point out to you that recovering home after a procedure is a short-term care or long-term care health plan. And not leaving a financial burden to their family is a final expense plan. That is the format for every conversation we have with our prospects. Managing the cost of doctors, hospitals, prescriptions, recovering home after a procedure, or not leaving a financial burden to the family. That's what they're primarily concerned about. And the reason for that is they want financial protection from the Medicare deductibles and copays. We already know that, right? That doesn't mean that they don't want value. They're not saying they're cheap. They're saying they're cost conscious. The freedom of choice of a provider and minimal hassle-free factor is critical. We already talked about portability of coverage. When I go to Vegas in July, if I have a health issue, I want to be able to go see a doctor, hospital, or clinic that I feel comfortable with. And I don't want to have to jump through hoops. I don't want to go through a hassle factor in getting to that person. And I don't think you would either. Consequently, you need to have that conversation with them. This generation is more affluent than their parents were. So if you're marketing to the right demographic, then you've got the right people. Ironically, they consume a lower amount of healthcare service than previous generations. They're actually in better health. They take maintenance medications. They tend to be more active. My counsel to you is to be more powerful versus passive. Make sure that the prospect is engaged. And the way to do that is you have to use language that takes charge of the meeting with the prospect. People don't want to take their valuable time to deal with uncertain salespeople. They want to be sold on what you're selling. And we're going to talk more about that in future webinars. Use powerful, not passive language. The language you use when working with prospect has to be powerful. We want to understand the difference between features and benefits. You're going to have a homework assignment at the end of this where you're going to spell this out, and then we'll explore it on our next webinar. If you've been selling for a long time, you've heard about the concept of features and benefits. The feature is what a product has or does. The benefit is why someone would want those features. In other words, features are about the product. Benefits are about the user. What will the product do for them? That's different than what the product is. For example, if you have something that's metal instead of plastic, metal might be the feature. But the benefit might be that it's more durable, longer lasting, or unbreakable. Features are the language of logic. Even people who say they buy logically or based on features do so because that's what makes them feel better. People buy on emotion and move to action by logic. Benefits are the language of emotion. You have to sell the problem they have, not the product you have. Focus on emotions, not intellect. Aim for the heart, not the head. People buy on emotion, they move to action by logic. So what kind of questions should we be asking? Well, ask the prospect questions that make them evaluate new information. Ask questions that qualify needs, not just uncovers them. Ask questions about improved access, control, and savings. Ask questions about lifestyle issues or personal goals. Ask questions that separate you from the competition, not compares you to them. And ask questions that make the prospect think before giving a response. Ask power questions that create a buying atmosphere, not a selling one. We're going to talk in our next couple of webinars exactly how to do that. We're going to go through the exact wording and phrases to do that. In the meantime, you're going to get some homework. I want you to fill it out so you start getting in the practice of it. A critical success strategy to enhance your learning skills or listening skills. After you ask the question, write the answer down. The only way you can parrot back to them what they told you in an earlier part of the conversation is if you remember it, and you won't remember it. So write it down. Let's kind of wind this up and talk about what I mean by predictable buying behaviors. We know there's three things someone aging into this next phase of their life going to do, almost without exceptions. We know they're going to sign up for Social Security. We know they're going to automatically be enrolled in Medicare. We know that they're going to get some retirement benefit from work, right? And when they automatically enroll in Medicare, 80% are going to get some kind of supplement. This is the perfect time to talk to them about final expense, and I'll show you why. Let's talk about what else we know about this profile prospect before we even talk to them. We know how much they're spending on health plan care right now, because we know that health care is anywhere from $1,500, $1,800 to $2,500 a month. So we already know they have that money in their budget, right? We already know where they're going to get the money to spend for this product. They already have that money in their budget. Even if they have dependent coverage on group insurance, they're still spending that money on their budget. That means if they get a Medicare supplement, $1,800 a year, they're going to reposition money that they're already spending $16,000, $18,000, $25,000 a year on healthcare. They're already spending, it's already in the budget. They're going to reposition $1,800 of that out, pay for the Medicare supplement plan, and when they do, their wife's going to need her own standalone plan because they'll come off her plan. So we know what product they're going to buy, a supplement, the Medicare Advantage or Medicare supplement. We know where they're going to get the money to pay for it because they've already got the money in their budget. We know that when they pull that money out and pay for their supplement, that's going to leave the balance of the money they were spending for the healthcare plan. What's the word I said we use? Anyway, we know their spouse is going to need her own standalone health plan. That's the perfect time for both of them to get a final expense plan. The money's already in their budget. They're spending it anyway. They're going to reposition that money to pay for that supplement. You package it with a final expense plan for both of them. They still get money back in their pocket. And let me show you why this final expense plan is perfect right now. 2-3 years later, she's going to age into Medicare. She's going to go off that health plan, and she's going to get a supplement. We know where she's going to get the money to pay for it because she's already got the money in her own health plan, right? We know what the plans cost because they're filed in every state. And here's what happens. The average Social Security check, go to Google and search it out yourself. The average Social Security check right now is $1,609. The average retirement income from work is $1,200. That's $2,809, the average. The average spousal Social Security is $900 a month. But at the husband's death, if you fast forward 5 years, 10 years down the road, when the husband passed away, most likely women tend to live longer than men, so the husband will pass away first. When the husband passes away, the wife's going to have a choice. And her choice will be to keep her Social Security at $900 or keep her husband's Social Security. Which one do you think she's going to keep? If you said her husband's, I would agree with you. Most likely she will keep that. Here's the thing though. She's making a conscious decision when she takes that spousal Social Security. She's making a conscious decision to give up $900 a month, $10,800 a year in the most emotionally devastating time in her life. She's choosing to live on less money. That's why you take the premium dollars that they're already spending on healthcare and package your supplemental products with final expense instead of putting it back in their pocket and trying to get final expense later. You get it at the time you have the most influence with them. That's when they're already buying a solution from you. And you get it at a time that they're already getting a savings. So the savings they get has more value because they have a health plan and a final expense plan, because the one thing that nobody else is talking to them about is replacing that $10,800 less income that first year. And you can make that first year transition for the surviving spouse easier. Over 10 years, that's $108,000 that spouse is choosing to give up. And you can address it at a time that these concerns are most predominant on their mind. And the reason they're most predominant on their mind is you sold with finesse, you were a professional with them, and you talked to them about the things they use the most in the order they used it. We're going to talk in our next webinar about asking questions. The most powerful sales calls are 25% effective with questioning and talking, 75% listening. By the way, that means you're spending 75% of your time listening. We want you to listen to understand, not listen to respond. You got a homework assignment. I want you to fill out what the predictable behaviors are. So here's the chart on the top left. Make a list of what you have. So if somebody does business with you today, right now, what do they get? What do they have? What do they have by doing business with you? In the middle, what can they get? What if they did business out in the marketplace? If they could get the same plan out in the marketplace from any other call center, any other broker dealer, anybody else, what would they get? And then take a few minutes and figure out why you. Why should they do business with you? Features are what the product has or does. Benefits are why your prospect would want those features. Make a list of the features on the left-hand side, and then on the right-hand side, write down why those features are a benefit. People buy on emotion and move to action by logic. Remember, features are the language of logic. Even people who insist they buy logically or based on features do so because that's what makes them feel better. Benefits are the language of emotion. Focus on emotion, not logic. So when someone gives you an objection, is it a logical objection or an emotional objection? If they give you a logical objection and you give them an emotional response, that may be why you're leaving money laying on the table. If they give you an emotional response and you give them a logical response, that may be why you're leaving money laying on the table. Remember, people buy on emotion, they're moved to action by logic. Last thing, sell the problem people have, tell them the solution you're bringing to them. We'll talk to you on the next webinar.